I've been involved in the praised research study throughout the longevity of the intervention part, which is drawing to a close soon after about 5 years. The study is managed by Nottingham University, and at Notts Healthcare we have been putting the study into action, started with a feasibility study and then a main study and then recently an implementation study. Praised stands for the promotion of activity, independence and stability in early dementia, and it aims to help people with mild dementia be more active and stay stable and remain independent. We know there's lots of adverse consequences of dementia, and the study aims to show that the intervention from OTs and physios and support workers at an early stage of dementia can really help with people's quality of life. It's been an absolute pleasure to be a physiotherapy that puts the intervention into place. We get to make a real significant impact on people's lives. It's such a pivotal point when they've only just received a diagnosis of dementia. It makes so much sense to prevent problems occurring by educating, encouraging and supporting people with a risk enablement approach to maximising people's quality of life. Hopefully this research will demonstrate the value of this preventative approach to people's lives and as well as being more cost effective.
Hi, my name is Patricia Dion and I am a physio by background and also the Falls lead for the Finch implementation study. Finch is Falls in Care Homes, and the Finch trial aimed to determine the clinical and cost effectiveness of using the Guide to Action in Care Homes tool for a process for falls prevention in care homes in comparison to the usual care. The reasoning behind this were that over 420,000 older people live in care homes across around 15,000 homes. Falls accounts for 40% of all injury deaths in care homes, and they are 3 times more likely to fall in care homes than in their own property. 1 in 10 of the residents who fall will go on to sustain a fracture, and 60 to 80% of residents are cognitively impaired. And what we know is that everybody is responsible for falls. Falls are everybody's responsibility. And the care home trial looked at whether we could reduce or manage falls, because we know that falls cause injuries and distress, and that falls, as I've said, are 3 times more likely to happen in care homes than in their own homes. But we also know that the impact of those falls onto the residents' quality of life, but also potentially onto their life expectancy. So 84 care homes took part in the initial trial. 39 of those care homes received the normal standard care, but also used the Guide to Action or the Action Checklist, Falls Checklist, and 45 care homes received their normal input, so they were the control group. What they found was that they managed to reduce the falls within the care homes using the checklist by 43%, which is huge, and with using focus groups and interviews for management, the residents, the care home staff and the falls leads within the trial, they found that none of the interventions adversely affected the residents' activity or their dependence levels, which was brilliant. The mean age of the residents for the study were 85 years old, just under 70% were female and just over 30% were male. And the second part of the study now, so that the trial has completed and now we're doing the implementation study. And what we're looking at now is how this will work in the real world within care homes and what the blockers are to actually implementing this within care homes across the country. Under my control at the moment, we have 9 care homes within the county, within Nottinghamshire County, and there are a further 9 care homes within Nottingham City who are taking part in the implementation study. And we are currently training the staff to use the Guide to Action, also called the Action Falls Checklist, to use with each one of their residents to see if we can reduce the number of falls that they're having with suggested actions. And at the moment this is still ongoing and we're still delivering the training. Thank you.
Hi everybody, I'm Alice Kilby. I'm a physiotherapist. I'm consultant therapist for falls prevention for the organisation. I'm talking to you about a piece of research that I'm involved with. Thanks so much for the opportunity for me to tell you a little bit about this research that I'm currently involved in. And it's developing a falls management tool for people with learning disabilities. AHP Day feels such a great opportunity to tell you about this work, as it's research led by AHPs, and it demonstrates such lovely collaborative working across our organisations, but also across our health and social care system, but more importantly with our patients. It's a real joy to be involved in this study because it's developing things for our patients, with our patients. So, we know that the number of falls is higher in older adults with intellectual disabilities than that of the general population, and that there's a need to develop falls prevention strategies that are specifically for older adults with intellectual disabilities. The Guide to Action tool that we use here in Notts Healthcare has been the starting point. Now rebranded as Action Falls, this tool identifies risk factors that support action to reduce falls. It's been demonstrated to be really beneficial in older adults, particularly those that live in care homes. And so this NIHR funded study is looking at how we can use the Action Falls programme and adapt it specifically for people with a learning disability. And it's this adaptation that's been done in such a lovely collaborative way. I suspect it's quite easy to pay lip service to co-production when it comes to research and service redesign. But in this study, it's really actually properly happening, and that's where the joy and strength of this work is. Nicola, another physiotherapist who's working on the project, has completed semi-structured interviews in really brilliant and creative ways. She's used her artistic skill to engage adults with a learning disability and the people who care for them and that they care for in discussion about falls risks, what's important to them, and how we can manage these risks. This has been completed alongside workshops with healthcare professionals from across AHP nursing and medical professions. All this listening with curiosity that we're so great at as AHPs by the team has enabled the Guide to Action tool and Action Falls programme to be adapted to meet the needs of people with a learning disability. Well, that's what we're hoping. There's probably another bit of research that we need to do to find out if that actually happens. So like I say, this research is AHP led. Katie Robinson works over in NUH and at Nottingham University, and it's supported here by physiotherapists here in Notts Healthcare who are able to share their expertise. Carol Tucker, who's now retired, but Stuart Hodgson from the Learning Disabilities team, and myself, as well as other experts from actually nationally, experts in learning disabilities who've got clinical expertise, but also in the research world. You know, before I was involved more in research, I used to think it was something beyond me, something for people more clever than me, something that I couldn't possibly do. But now I'm in it, I've realised that actually it's a bunch of great people talking to another bunch of great people who really want to get this right for their patients. And holding collaboration at the heart of it is something that we're really great at as physiotherapists and as AHPs.